Acupuncture, a system of integrative medicine that involves the insertion of needles into specific points on the body to elicit a powerful healing response through neurohormonal pathways. Acupuncture is my life. Let us begin.
Hello, everyone, and welcome back to my show. I'm Dr. Lott, your host and educator from Acupuncture is My Life. Now, today, we're in part 3 of Acupuncture and Psychotherapy, the final episode. And I'm here with Dr. Ada Sandoval. Good morning.
Good morning, Dr. Lott. Thank you very much for inviting me to your show again.
You're welcome. You're welcome. And today, we're going to discuss anger, extreme anger, and how it serves as a detriment to the human body, and how psychotherapy and acupuncture can help it. Okay? Now, when it comes to anger, the effects of anger on the autonomic nervous system can be disastrous. Now, the autonomic nervous system is comprised of sympathetic nervous system and parasympathetic nervous system. Now, sympathetic nervous system is the fight or flight aspect that we all have within us. Like when we see the bear or the tiger coming, we can run as fast as we can, or we can turn around and have extraordinary strength to fight off this bear or this tiger. And that's when the kidneys is emitting a lot of cortisol into the bloodstream to give us tons of energy. But what can also trigger the sympathetic nervous system is anger. Anger puts us in a fight or flight state, and when we're in a sympathetic nervous system state of being for the moment, we no longer digest food, we can't relax, we can't move our bowels or any type of excretion, which becomes bad. Because when this carries on for a long period of time, we begin to overtax the body. And this is where psychotherapy and acupuncture work well. Because you see, there are sky window points that treat anger, extreme anger. There's general body points, points on the head, points on the extremities, that's very calming. And it really balances the body out. But before I get into that, I want to get a nice understanding of a psychotherapy approach to dealing with anger. And Dr. Ada, how would you deal with anger when you see patients that are faced with extensive bouts of anger, or you're able to diagnose it?
I thank you very much, Dr. Lott, for
You're
explaining the biology of what's going on with anger in our bodies. But I think the approach to really look at what's going on, it's encompassing the biopsychosocial approach, which we have talked about it before.
Yes.
And yes, the sympathetic nervous system will arouse you and the parasympathetic nervous will calm you. But for us to become aware of how to deal with anger, we have to be focused. The frontal lobes is the part of the brain that is responsible for making decisions and how to deal with what's going on with us, and decision making, and also speaking. We could identify, instead of reacting, we need to stop, think, and act. And that will help us to deal with anger. Of course, not all of us will know how to do that. Part of that is coming to psychotherapy and trying to identify those issues that are really pushing our impulses.
So let me ask you, now, when you're with a patient, you're dealing with that, what's your general approach?
I think one of the first things that we have to do is to become aware. Most of our behavior is unconscious. They're pushed with unconscious motivations that we don't know. So we need to be conscious of those issues that are triggering that anger. And then the patient starts to identify them, and then the patient starts to manage them, and then you'll see the outcome. Because controlling impulses is actually not so easy to do. People are more prompt to react and, oh, I don't like you. I'm thinking, the brain is thinking, and you're angry and then you slap the person instead of stopping, thinking, and then acting, and stop that behavior. So it's really a process of learning how to do that, how to control your impulses.
Well, I'm sure that this requires like several sessions.
Definitely.
Because, when you speak of triggers, that means that, well, to me, triggers are acquired over a course of a lifetime. From things that have occurred in a person's life, that at a particular moment, something can happen to sort of like push that button to get them to respond. So you're saying that you have an approach to get them to sort of suppress or cut off that trigger permanently. Is that what you're saying? Or
what we're trying to do is to bring it up instead of pushing it down.
Bring it to the surface.
Bring it to the surface so that the person could deal with it, so that you are aware of what's going on. The person doesn't know why you are reacting that way. Mm-hmm. When you come to therapy, you start bringing those issues up, and then you start identifying what those issues are and then manage them. If you suppress them, if you put them down, they're going to continue to be there, and they're going to come out in a different way. That's the word of trigger that you talk about. So I could be angry at you and not show it in a way that is telling you that I'm angry. Right. And then I'm going to react. That's the difference.
That's interesting because, I explain this to my patients when it comes to acupuncture. Like, let's just take, for example, there will be a patient who's had a deep itching sensation for years. And I'll put together a treatment protocol. Then all of a sudden, they'll notice, like after 2 treatments, they're seeing rashes in the area. And I'll explain to them. I'm bringing it to the surface.
Exactly.
Then it becomes easier to treat and get rid of. And the irony, like going back to the autonomic nervous system when we talk about sympathetic and parasympathetic, and of course the parasympathetic is more of the calming aspect of the autonomic nervous system. This is when you can excrete waste from the body, you can sleep thoroughly throughout the night, you relax, and you properly digest food. Now, anger also affects the enteric nervous system. Now, the enteric nervous system has a huge responsibility in modulating the immune system as well as the endocrine system. And it also controls local blood flow in the stomach because studies have shown our stomach is our second brain. Okay? So the actual brain and the second brain has to be in alignment with each other. And this is why psychotherapy is really good along with acupuncture. Because a lot of times we can literally starve ourselves of proper nutrients as a result of being stressed and angry a lot and living in a sympathetic state of being. Because now your stomach, which governs the enteric nervous system, is no longer properly processing food. And it's passing in your stool and you're losing the nutrients that you need to survive on a daily basis. And that's why acupuncture and psychotherapy is great, because seeing, let's say, a psychotherapist such as Dr. Ada and her introducing these triggers that you've acquired over a course of a lifetime and allowing you to address, to eventually suppress, and then coming to see me to reinvigorate proper digestion. Because there's points on the stomach. You have the Ren meridian that's in front of the body that controls the yin organs. And there's points on the Ren meridian, especially CV12 at the center of the stomach, that's good for reinvigorating like optimal absorption of nutrients after you eat, to really bring you back to good health and avoid, possible starvation. Starvation in ways, I don't mean in the sense that most people only know of starvation, like someone's not eating and they just die. It's not that way. You can suffer from malabsorption and it can shorten your life. Starvation in that sense. Well, let me ask you, Dr. Ada, and just closing on the trigger aspect of things, like, have you noticed or encountered some cases with your patients where they've had difficulty in dealing with some of the triggers that you've brought to the surface? Now, some they may have been able to cope with and get over and suppress, but has there been any cases where they've struggled with dealing with one or two of those triggers?
Yeah, individuals struggle with issues if they're not dealt with. So when they do come to therapy, we try to bring them up and talk about them. I think that they need to communicate their experience, and I think that that's their success in therapy. And each individual will find that out.
Right.
I wanted to let the audience know that we do appreciate your knowledge about biology and how the connection with the psychology really improves the lifestyles of individuals who are dealing with anger, because a good percentage of the issues biologically will show, like skin rashes, diabetes, high blood pressure. So the connection between the psychology and the biology of the body are in sync, and it's necessary for them to work in a balanced, leveled playing field so that the individual could really feel that they're happy and they could manage all of these issues that are happening with them.
Well, this is why I say acupuncture and psychotherapy works well. It works great as a combination, because when you're put back in a parasympathetic state of thinking or mindset or being, and then you come and you see me for acupuncture, and I restore proper, let's say, digestion, absorption of nutrients, and elimination returns. I noticed that some of the patients that we've worked together on, very calm. Yep. Their attitude about life from a mental and physical perspective. I mean, you see the difference. You see the glow in their face and in the energy that they have. And they've said, after seeing Dr. Ada several times and seeing me as well, they can sleep through the night. Yep. Because a lot of times when people wake up, let's say between the hours of 1 a.m. and 3 a.m. in the morning, that's the liver meridian showing signs of imbalance. Now, the liver meridian controls anger in Chinese medicine. And that's one of the questions that I tend to ask patients. Like when they come in and I see that they need therapy or counseling, and I'll recommend you to them.
Thank you.
And I'll speak about the combination of acupuncture and psychotherapy and how it can benefit them. One of the top 3 questions I'll ask is, do you ever wake up in the middle of the night? And most times I'll get patients that'll say, yes, I do. And I'll ask what time, and they'll state between the hours of 1 and 3. Right. And sometimes they'll have a hard time falling back to sleep. And that's when I notice disruption in the liver meridian. We'll sit and talk, and I'll complete the diagnosis. I'll put together a treatment protocol, and then the recommendation to see you as well. And a lot of my patients have come to see you and come back to see me, and it's a matter of a few sessions. And they're feeling so much better. Well, I want to say, this is part 3, and I want to thank Dr. Ada.
You're welcome.
For speaking to my audience, and
Thank
much appreciated.
Thank you very much. And good luck to the audience.
Yeah, good luck. And if you have any questions at the end of the show, you can contact Dr. Ada at her website, or you can give her a call. Contact me as well. And also remember, don't forget to subscribe to my show. And until next time, acupuncture is my life. What's yours?